Can you tell me your name and what you do?
My name's Iain Macbeath. I work here for Hertfordshire County Council, and my job title is Director of Health and Community Services, and that involves looking after adult social care, health integration and the library service.
What have you done in terms of co-production?
Oh, quite a lot really. I mean everything from implementing big bits of legislation all the way through to designing new services and helping people with their care plan. So everything all the way through. Well, if I give you an example, from April this year, we had to implement a big new piece of legislation called the Care Act. And part of that legislation was to change the way we assessed people who use services and also assessed carers. And we looked at all the paperwork that the council was currently filling in when we were doing those assessments. I think the service user assessment was 35 pages, and I think the carers one was 8. So that's quite a lot of paperwork every time. And I wasn't convinced that actually the end result was any better for filling in those 35 pages. So we decided we'd try and take the opportunity to shorten the forms. So we asked people, how would you like to be assessed? You know, and particularly people who'd already been through the assessment and care planning process. If, you know, knowing now what you know, if you could do it again, how could we have done it better? They gave us some tremendous feedback. And they said, we don't know why you asked me that and you didn't ask me that. And you never asked me anything about me, or why we phoned social care, or a little bit about my history, or what's important to me. So we built all that now into our forms, into our assessment forms. And we call them conversations now rather than assessments, because that's much less scary for someone who doesn't know social services. And the first question we ask is, tell us a little bit about yourself. And the second question we ask is, why have you phoned social care? Why are we here? What do you need help with? And we work our way in from there. And so our assessments read much better. We try and write them in the first person. So we write, you know, I have called you in today because then it's in the words of the person. It doesn't get wrapped up in professional language and all those abbreviations that people use, all that kind of thing. And so I'm pleased to say that the form that was 35 pages long is now 6, and the carers form is now 4, and that includes contingency planning for both. So it feels like we've got something which is much more meaningful for people. It takes a shorter amount of time, and people tell us they understand it. A carer at a conference about a month ago told me he'd had his assessment and he thought it was stunning. So I was quite pleased with that. Then when it came down to different projects, so like our health integration projects, we said to people, this is what you currently receive from the NHS, this is what social services currently does, can we do things differently? So we asked some really open questions of people, and they gave us lots of feedback about the areas to focus on and what they'd like to see. We've also done some projects just to modernise some of our existing services. So we've got a lot of day services in Hertfordshire, and they've been the same for the last 5 or 6 years since the last big transformation. And people now tell us they want something quite different. So we've been asking them about that. How do they want them modernised? And they tell us they want them services at evenings and at weekends and different transport and different activities, more community stuff. Different work and leisure opportunities, and so we're reshaping all our services based on the feedback. So for us in Hertfordshire, it means people and their carers are of equal value as professionals and commissioners buying services.
Can you reflect on what you have learned?
I suppose one thing we've learnt is we are trying to work really closely with our partners in the NHS, and they design services, health services, just as we design social care ones. And a lot of the feedback we get from people is they can't understand why they see 2 sets of professionals. Why does a nurse come and then a carer comes almost within the same hour? They can't get why everything's so separate. And so what we are trying to do is work with the NHS to co-produce new services with people and their carers. not just design new ones on the back of what we think people are going to want to see. So we've done quite a few listening sessions with people with long-term conditions. We did a few listening sessions for people who'd had a stroke or their carers. About 700 people a year in Hertfordshire have a stroke and suddenly find themselves needing health and care support straight away. And all the evidence is if you don't give them that support quite quickly and intensively, then they get worse and they need care and support all the rest of their lives. If you get in there quick and really try to intervene and rehabilitate them and give them therapies, then they can recover and lead fulfilling lives. So we've done a lot of listening events for them, and we've got new health pathways now for people with long-term conditions and people who've had a stroke, and they're very well received, and we're evaluating those now. I suppose the next thing is the experience that people and carers have got is absolutely invaluable. We can't ignore it. They see all parts of the system. We only see our little bit. And so what they always bring whenever we have a co-production session is, well, hang on, you do that part, but don't forget these other 3 or 4 professionals that I'm also seeing. And we think, crikey, why didn't we think of that? And it involves better partnership working, and that's what we're all striving to do.
What difference has it made working in that way to the people you work with and the organisation you work for?
If I pick an example of how we've really tried to make this work here in Hertfordshire, we, like every other council, we operate a sort of a home care service, mainly for older people, but for other people as well. And they're calls that individuals get every day to help them perform daily living tasks. And there's been a general level of dissatisfaction, really, about those services for quite a while. So we've just retendered all of our services. So the first thing was to ask people, well, what would you like? If you're not satisfied with the way things run now, what would a good service look like? And they told us. And so when we wrote our specification and when we were interviewing new providers, we were asking them about all the things that people and their carers had told us about having the same carers, continuity of care, them being reliable, them being kept informed, so all the stuff that the lessons that they taught us. But more importantly, once the contracts were tendered, we didn't want to stop there. So each of our lead providers, and we've got 5 in Hertfordshire, we've asked them to set up what's called an advisory board. And that board will meet every month, and there'll be one for every lead provider, and there'll be at least 3 service users who received home care from that care provider that morning, and they'll be getting in a taxi and they'll be driving to that advisory board to give them direct feedback on what they're receiving as part of that service. And I can't think of anything more motivating for a provider than having to face someone who received a service from you that morning, and it's really having an impact on the quality of the service being delivered.
Can you give an example of how it has avoided making costly mistakes by getting it right, or better first time through co-production?
Yeah, I mean, one example I give is around our website. So as part of the Care Act, it said we had to improve our information and advice offer to people. Nearly all councils have got websites, but some of them are very boring. And so we had a look at ours to say, what's the content look like? What's the style look like? Can people use it? And the feedback was people didn't like it and did sometimes struggle to find the information they wanted. And as a result, they picked up the phone and they phoned us instead, and that means we've got to have people on the end of the phone. And of course, people who wanted information didn't get it when they wanted. So we did some work with people about what information they did want on the website, and they told us they wanted more videos, and they wanted simpler information, and they wanted to be able to navigate to it very quickly and easily. And also, people see websites like Amazon where if you search for one thing, it says, oh, you've searched for this, you might be interested in this as well. We've got that now on our website too. So we've actually said, well, people who look for this are often also involved in this. And so our website now shows both of those things. So all that was as a direct result of feedback from people. The really other clever thing that we've done is we've got this clever bit of software that allows us to email people and say, click on this web link and tell us what you think. And it's only there for about a minute, and they've got to look at it and tell us, give us immediate feedback what they think about it. And we've got about 500 people who use services doing that for us every other week. And they give us some terrific feedback, and all of our web pages are now customised and tailored according to what people have told us. I think the other thing that some councils have struggled with, and we struggled with for a time, was what is an outcome? And we have this discussion quite a lot in the council about what are outcomes, and what trying to encourage people to say what is it they really want, and then what do we write down on the bits of paper. And I think what co-production's brought to us is really focusing on what outcomes are. Because when we're designing services now, we are talking about people feeling safe, or feeling they're clean, or feeling they're enjoying what they're doing in the daytime. And they're the outcomes. It's not, I want 10 hours of home care a week. And sometimes we're always guilty of writing, what outcomes does this person want to achieve? And it would say 30 minutes in call in the morning. And you think that's not an outcome. It's the fact that you're up and dressed and ready for the day, and that's the outcome you want. So, I think one of the benefits for the organisation has been to help us really hone in on what outcomes are and make sure that that's what the services are achieving for people.
Do you have any top tips for co-production?
Yeah, I suppose the first one would be involve people as early as possible. So not only ask them questions about what about this service, or what about how we've designed this, because that's consultation, that's not co-production. So ask them really early on, A, what do they want to talk about? B, what services do they want to see improved? And once we've got to that stage, then get on to, well, what would that look like, and how can we design that together?
Have you got any advice for other directors?
Do it. That'd be one. I suppose the advice would be, it's not easy really, so you've got to put a lot of time into it, but it's worth it. So if you can direct your resources towards doing co-production properly, not consultation, not communication, actual co-production where you take the time sitting down with people and carers really early and having discussions about what needs to change, what their views are, and then co-designing services, it really pays off. People are more satisfied, and ultimately you deliver better services.
Is there anything else you would like to say about co-production? I suppose the key thing for me is trying to get across to staff and our managers about what co-production is, because a lot of people think it is consultation. They do think it is, we've designed this terrific service, what do you think, yes or no? And that's not what co-production is. So I've got 2,500 staff here at the council, and I've got to get across to them what it really means. And for me, what it means is staff, professionals who've got qualifications and all of their experience. That's equally as valuable as the lived experience of people and their carers who need care and support, and only by using both at the same time together to design very high-level strategies, new services, or even somebody's care plan. All of those things, people are equal. If we do it together, we get the best outcome.